So worksheet number 4, just cardiovascular system regulation, blood vessels, cardiac output. So this is kind of like the miscellaneous worksheet, and I didn't know how else to compile it besides putting it together. So that's just what we're going to do. So question number 1 is asking which conditions below does not stimulate the sympathetic or the parasympathetic fibers of the heart. So physical exercise, the concentration of ions such as potassium and calcium, the fight or flight response, and body temperature all stimulate the parasympathetic and the sympathetic system to work. The only one that doesn't stimulate is rest and digest, and it's kind of like in the name there. The rest and digest, like just relaxing, does not stimulate your heart. It may slow down your heart, but it doesn't stimulate it. It doesn't cause it to do things. But everything else does stimulate it, if that makes sense. Number 2, baroreceptor reflexes from the cardiac control system in the medulla oblongata balance the parasympathetic and sympathetic effects. So in the cardiac system, the medulla oblongata, which is in your brainstem, it's really important to kind of like regulate how fast the heart is going or how slow it's going. Make sense? Okay. So going down to like the chart, we're going to talk about the sympathetic impulses, and then we're going to talk about the parasympathetic. Sympathetic impulses kind of stimulate the heart. So the name of the nerve is called the accelerator nerve. So this pathway will accelerate the heart, and it'll make it beat really fast. Effects on heart rate, it increases heart rate. The cardiac control center is the cardio-acceleratory center, and the CCC, cardiac control center, connects to the SA node, AV node, and the atrial and ventricular myocardium. So this is just graph is supposed to help break down things. So if you come in your reading, you can at least have a good, you'll know where everything is kind of connected. So the SA node and AV node are electrical portions, atrial and ventricular myocardium. That just means the muscular portion of the heart. So we like beating, so we need electricity to control that. The next half of it is a parasympathetic impulses, and the parasympathetic, think about parasympathetic, you're paralyzed, you're not moving. This is going to slow down the heart. And the main control of the main nerve that controls this, the slowing down, is your vagus nerve. Your vagus nerve has an effect of decreasing heart rate and is part of the cardio-inhibitory center. So inhibit means stops. It's kind of broken down there. What does the cardiac control center of the parasympathetic pathway connect to? Well, it connects to the right vagus nerve connects to the SA node mainly. So even though it's parasympathetic, it connects to the SA node, which is a little bit confusing because the sympathetic and the parasympathetic are connected both to the SA node and the AV node, but they still, one says speed up, one says slow down. Does that make sense? So the right vagus nerve connects to the SA node, while the left vagus nerve connects to the AV node. So even though the SA node is the primary pacemaker, it speeds up the heart. Sympathetic impulses basically control SA node. Think about sympathetic stimulate SA node. That's like the main control. Your parasympathetic is more so associated with your AV node. So, but if you come across in your reading, it's talking about the SA node, AV node, and everything. Just they connect the both, but that's just the pathways. I don't know if I made that more confusing. So, and I doubt that she'll ask. She may ask about the vagus nerve, or, she'll ask about vagus nerve. So, AV node, V, vagus, SA node, S, sympathetic, stimulate. Maybe that'll help some. But just if you're in your reading, you read that they connect to both. They do connect to both. So just to make that clear.
Mom was at dental work.
Uh-huh.
And as the vagus comes down, somewhere back in here, right? To all heart.
Yeah, it connects to every organ, so I don't quite know where. Yeah.
Here's, somehow I got into that nerve accidentally, of course, maybe it was with the numbing medicine.
Oh.
Anyway, she stopped reading.
Yeah.
Controls your.
Yeah, controls. Yeah, the vagus nerve is really important for breathing, heart rate, organ.
The dentist ended up not reading.
Yikes. That's not fun.
Can you go back to that?
Oh, yeah.
Just for 1 second.
No, you're good.
Sorry, stop.
You're okay. No. No, that's awful if you get stuff in your vagus nerve and it stops your breathing. So, or if you destroy it or cut it or, oh my gosh. Wow. That's awful. Is she okay now?
Fine, yeah, but it's just,
Oh, it was numbing. Okay.
for a little while, they call the ambulance.
Figured it out. Wow, that's pretty. I would not like. I'd be like, I'm not breathing. But yeah, but that's a good thing with your another thing too is you hear about people vagling out. So when that happens, actually I have this effect. Like if I see like blood or I see like a needle. I was in clinical, which is like the best place to figure this out, right? And oh my God, it was awful. Well, anyway, they were doing a thoracentesis, which is when they take fluid out of someone's lung. So they got this big needle, and I was like, cool, I'm going to go see this. And I really didn't think I'd have a problem with it. Took a big needle, put it in my patient's back, withdrew some fluid. Really neat. My heart rate started slowing down. And that's what a vagal response is when your body kind of freaks out and your heart beats slower. So because of that trigger, I started like slowing down. I couldn't hear things because I wasn't getting any blood flow to my ears. I started not to see things because I wasn't getting any blood flow to my eyes. And I just was shutting down very slowly. So I like got out of the room and I fainted. So it happens.
Basically what fainting is, right?
Yeah. Yeah. Because your heart isn't pushing blood to your brain. So in order to get oxygen to your brain, you faint, right? Because then now blood can now flow to your brain. Your brain is happy. You may not be when you get up. So, yeah. Great. Yeah, so if you ever need to think about vagal nerve, it slows the heart down, and then you can faint. So, which is odd because I freak out about everything. So it's interesting how I would have a... But the thing is, you can develop over time once you're exposed to it over and over again, you'll be fine. But yeah, just my story. So some cardiac control centers of the cardiac cycle. This includes baroreceptors, which are also known as presoreceptors. I don't know how much of this I had you guys filling out. Yeah. So that's good. That's good. I didn't have you filling all of that red out. And these are in the aorta and the carotid artery. So these are kind of like in your neck. Baroreceptors in the vena cava near the right atrium. So over here are where those receptors are. And those detect blood pressure. And if you have high blood pressure, ideally your heart's going to pump slower. So it doesn't have like a whole lot of damage, right? But if you have high blood pressure and your heart is beating really fast, you have a bunch of fluid in your veins and vessels and everything, that's not really good because it puts a lot of stress on them. Another control center is your hypothalamus, and this has to do with emotional upset. So your hypothalamus, which is also important for the endocrine system, also plays a role in your cardiac control system. So if you see a question about emotional upset, and is looking for like what structure, of course it's never this easy, but what structure in the brain is responsible for emotional upset? Well, your hypothalamus. Could also be like your limbic system also, but your hypothalamus controls everything. So there's that. Another control center is your vagus nerve, like we discussed, which is your parasympathetic pathway, your rest and digest. It causes everything to slow down, which is great, right? However, parasympathetic tells your body to slow down, but what actually speeds up? Digestive system, yeah. So everything's resting, but the digestive system is digesting. So while everything slows down, you're able to digest a little bit easier. So just kind of keep that in mind. But vagus nerve, parasympathetic, slows down. You then have chemoreceptors for our oxygen, carbon dioxide, and pH levels, pH values. I think when we get to the urinary system, we just need to get to the urinary system. We're going to go over like the pH values like base and acidic, and we're going to go through compensation. Usually if you have too much carbon dioxide or if your body's too acidic, you're going to breathe a lot faster. And this can affect your heart rate and everything too. But if you have too little carbon dioxide or you're not acidic enough, you're going to breathe slower because you're going to want to retain that carbon dioxide. You're going to hold it in because it'll balance out, if that makes sense. But you don't need to worry about that now. When we get to the urinary system, yeah, go on.
I just like this occurs to me like when someone has diabetes, like it's just like you're too acidic, like
Yeah.
so you just like breathe very fast.
Yeah.
That's the signal.
Yeah, diabetic ketoacidosis. Is that what you're talking about? Like, so when you have diabetes, the issue is when you're not producing insulin. When you're not producing insulin, your cells can't eat glucose. If your cells can't eat glucose, then they'll find energy somewhere else, and that's in your fat. So what happens is that your body will break down your fat. It'll produce ketones, which will make your body acidic, and when your body's acidic, you start breathing faster because you're trying to get rid of the carbon dioxide. Yeah. And then you have ketones in the urine, which makes the urine smell kind of sweet. Or actually, back in the day, doctors actually sampled urine and tested if people were dying. Yeah, it's nasty. But going back to diabetes, when someone with diabetes, if they're going through diabeto-ketoacidosis, ketones are what fat cells produce. So they breathe faster, and that's a symptom. That's very, yeah. So that has nothing to do with the card. You guys don't need to know. That's just in conversation. Great stuff. Okay, another thing too, changes in ion concentration, especially potassium. Too high or too low of potassium is awful for you. Same thing with calcium. So you want everything happy medium. Just keep that in mind. We just need to get to the urinary system. So, next thing, that's a little off topic, so just know that there are different receptors, different ways of detecting. So next question, under sympathetic stimulation, the arterioles and arteries, they vasoconstrict. So you're going to cross out vasodilate, you're going to put constriction. So you're getting chased by what's the situation? You're getting chased by a bear in this situation. Typically, I think pack of lions because that's a little more interesting, but okay. So your heart rate increases to pump blood to your muscles. Your breathing rate increases so your tissues can get as much oxygen. But in order to increase blood pressure, you have to constrict. You have to get smaller. So if you think about pouring a gallon of water through a big tube versus a small tube, you pour it in a big tube and you kind of like push the gallon through it, it'll come shooting out. That's high pressure. That makes sense. You put it in a larger tube, it'll kind of like drip out. So that pressure is lower, if that makes sense. So the reason why sympathetic system, arteries typically vasoconstrict, they get smaller, so to increase blood pressure, and when you increase blood pressure, you can increase oxygen delivery to your muscles and your tissues and your brain. Isn't that great? Yeah, let's not get chased by bears though. So, which statement about capillaries is false? The false statement is rich capillary supply in cartilage, poor capillary supply in nerve and muscle tissue. To make it true, poor capillary supply in cartilage, rich supply in the nerves and muscles. And think about muscles are red because of all your blood. Other true statements about capillaries, and this is just little facts. They are the smallest diameter blood vessels. that exchange substances through diffusion. So small diameter, so red blood cells can like line up single file and exchange gases such as carbon dioxide and oxygen through diffusion. That's what makes it true. Osmosis, if we got into the urinary system, draws water into capillaries, and hydrostatic pressure forces water out of capillaries. So just kind of know, and we're going to go over osmotic and hydrostatic pressure here shortly. And then water and substances leave capillaries at the arterial end, and water and substances enter capillaries at the venous end. So I'm going to erase this. Do you guys want a picture? I already took a picture of this, but okay. So when we go into this, let's see, how can we take notes here? So just know that osmotic pressure comes from solutes. So you ever heard the phrase in chemistry, water follows salts? That's osmotic pressure. Osmotic pressure is kind of like magnets. If you have solutes in your body, they attract water, if that makes sense. And we'll get into this, don't worry. Solutes have the ability, or like they're kind of like magnets, they attract water to themselves. Water follows salt. That's wrong. I should say water follows salt. Water follows salt. Therefore, osmotic pressure draws water into the capillaries. Hydrostatic pressure, think about hydrostatic meaning heart. This comes from the heart pumping blood, forcing fluid out of the capillaries. Therefore, hydrostatic pressure forces water out of the capillaries. So in your next page, so going over this more so in depth, you're going to have this kind of figure. And you can follow along. How far is this? This is your heart. It's a really big heart. I don't need it that big. Oh, whatever. These are your arteries coming from your heart. And then you'll have your veins. And the veins are kind of blue. So you have this kind of picture looking. In your arteries and your veins, you have plasma proteins. And these are albumin, globulin, fibrinogen. But you just need to know plasma proteins. You don't need to know these in depth. So you have plasma proteins. So we're going to have 4 in each area. And then, so this is your heart, this is your artery, this is your vein, and I'm going to have your tissues in green. And your tissues could be organ tissue, heart tissue, stomach tissues, any tissue. You know, that's just what that means. So I'm going to scroll down a little bit more. Okay, so in the arterial end, so we're going to, even though we have a heart here, the heart isn't nearly as important as knowing which end we're at. So at the arterial end, here we go. Yeah, okay, that's recording. So at the arterial end, hydrostatic pressure is high. And it's high because of the heart. So increase hydrostatic. And hydrostatic pressure is like, so when the heart contracts, so it's contracting, fluid is going to be forced out of the arterioles because that pressure from the fluid is pushing out. So with this arterial end, I typically think of like plumbing pipes, how they're kind of bursting because they have so much pressure. Okay? It's kind of what's happening here. Although your arteries are not actually bursting, water is leaving them and going to the tissue. So this black is water movement. That's what I'm representing here. So hydrostatic pressure is high, osmotic pressure is low, and water leaves the capillaries. Okay? Notice how the heart is closer to the arterial end than it is from the venous end. So hydrostatic pressure, heart pressure, high, in the arterial end. The heart pushes fluid through the vessels and out of the capillaries. Hydrostatic pressure, pressure from the heart. More hydrostatic fluid causes water to leave the capillary. So the harder your heart beats, the more fluid is going to be pushed out of your capillaries. That's on your arterial side. On your venous side, because your veins are further away from your heart, hydrostatic pressure is going to be low. See, these are little arrows. Because you don't have all that pressure from the heart, like, you have it pushing out. So it's just going to be very little hydrostatic pressure. However, osmotic pressure is going to be very high. So if you think about these plasma proteins in terms of salt, pretend these are particles of salt, okay? Water follows salt. If you have a dilute solution, or if your arteries are typically they're diluted, there's more water than there is salt, or there's more water, there's more blood than there is plasma proteins, your osmotic pressure is going to be low because your arteries don't need any more water. Okay, they need to be pushing water out because they're too full. In your veins, though, osmotic pressure is going to be high because you can see there's less, these boxes represent how much water is in there. There's less water in your veins than there are in your arteries. So hydrostatic pressure is going to be very low because it's far away from the heart, but osmotic pressure is going to be very high because osmotic pressure comes from your solutes. They're kind of like magnets. So osmotic pressure is going to draw water from your tissues and into your veins because osmotic pressure is like magnetic power, I guess. So water follows salt, water follows solutes, water follows the plasma proteins because they're like magnets. So then this causes water to enter the capillary. Notice how there's less fluid in the veins because, as you can see, this box for veins is smaller. Most of the fluid that would be in the vein already left at the arterial end. So that's why there's less fluid in the veins because of the hydrostatic pressure from the heart. So if there's less fluid and there's more solutes, if it's more salty, it's more concentrated, high osmotic pressure. Kind of beating this in your brain, but that's what it is. So water follows solutes, water will go into the capillaries. Does this kind of make sense for the most part? It might take some reading over to do, but hopefully it's broken down. So when you come across osmotic versus hydrostatic pressure, just know hydrostatic pressure leaves the capillary, osmotic pressure goes into the capillary. So, and that's why it does what it does. It's because of that. So, I'm gonna. Do you guys need to take any more notes from this? Okay. The walls. So the next question. This is going to contrast some veins and arteries. The walls of the veins are thicker than arteries. This is false. Arteries are thicker than veins because if you think about it, arteries are close to the heart, okay? We need those to be thick. You know, would you rather have like a thick balloon material near the heart or a thin one, right? So your arteries are more muscular and they're thicker than veins are. Arteries can withstand more stretching than veins. This is true because, again, the stretching comes from the heart pressure on it, so you want your arteries to be stretchy. We do like that. So that's some stuff about arteries. So about veins now. Number 10 is saying veins are the largest blood reservoirs in the body, and this is true. Veins hold about I think it's like 75% or over that, or like 85%, I don't remember. But they're the largest blood reservoirs, which means a reservoir is something that stores blood. So the thing is you have a whole lot of veins all over your body, but typically on a regular basis, you have a lot more blood in your veins than anywhere else. But jumping back to number 9, veins have flap-like valves, okay? So here's your vein, and here are your valves. Okay, let's do this. Make your valves in green. So valves are just things in veins that, so arteries really have it made, okay? Arteries have your heart to pump blood, and arteries also have gravity. So going like this, blood is able to flow from my fingers, but because of gravity, it's harder to flow back up, right? So veins need some extra assistance. This extra assistance is known as your valves. And we like our veins having valves because when blood flows through your veins, the valves will open, which is nice, right? Because they're flowing up. Okay? Naturally. When your valves close, it allows blood to stay in that area. So blood will it'll kind of pool, but then it'll move up as they open and close and everything. So valves are really neat because they allow veins to transport blood kind of like a ladder. It goes from one valve to the next valve until it gets to the heart. And what really helps with moving your venal fluid or moving deoxygenated blood is muscular contractions because your muscles squeeze your veins. So you get muscular contraction that'll squeeze blood out through your veins and get it to the heart. That's what you like. The issue with valves, though, is if they become inverted. So see how this one's nice and flipped like this? When they become inverted, they kind of accidentally, so typically they're like this, but they sometimes flip by accident or by age or something. And this is bad because it prevents, because when blood pushes up against this, it'll kind of close those valves. And when those valves close, blood will pool and your body can't get that deoxygenated blood back efficiently, and that's why you have varicose veins. It's because of those valves. Those valves are closing up. They're not the way they used to be. Varicose veins, or like you get blue veins in your leg as you get older, or you see some old people who have like spider veins. I'll look at some pretty nasty pictures if you want me to. But yeah, so that's why valves are important, because if we didn't have valves, we couldn't transport blood. It'd all kind of be in our feet, and we'd have to spend 12 hours on our feet all day and then 12 hours with our feet against a wall or something so that blood can drain back. But veins are nice. They help us until they close, and then they're ugly. But yeah, so that's just a thing. Veins have valves, V. You can think of that in that way. One way to measure blood pressure is in your systemic arteries, but your radial pulse is kind of in right here by your thumb. Think about, this is right here where your radius is, your bone. Think about radical, right? You put thumbs up, radical. The thumb side is your radius. So your radial artery is on your thumb side, because the radius is the bone right here. So the radial pulse is the most common, or you can have your carotid pulse, or your jugular vein. Yeah, that one's nice. And then you also have your brachial pulse, where blood pressure is taken most of the time, which is right here, your brachial. So you can get blood pressure pretty much everywhere. I probably read in the book radial pulse is most common, so that's probably why that's there. Match some blood pressure definitions. Blood pressure is directly proportional to blood volume. So blood volume, when you think of volume, what do you think of? Amount, yeah. So with volume, how much fluid can it hold, right? So let's see. So this can hold more fluid than my coffee thing, except for I would never drink hand sanitizer. So the more blood volume you have, the more blood you have, the more fluid you have in your body, the more blood pressure you're going to have. But if you cut your leg open or you're really dehydrated, you're going to have low blood pressure. Yeah. So blood volume means blood pressure. No blood volume means no blood pressure. That means that you're dead. So let's not do that. So the next definition is stroke volume. And this is the volume of blood that enters the arteries every time the ventricles contract. So when we have a heart up here, your ventricles are the bottom part. Stroke volume is how much blood leaves those ventricles when they contract. That's stroke volume. Peripheral resistance. This is the friction between blood and walls of blood vessels. So if your walls of your blood vessels are very, how do I think about this? Think about like if this is nice and smooth, right? If our blood vessels are smooth, we can go sliding on the floor, kind of like this floor, right? But if our blood vessels are like carpet, if there's a lot of resistance, then you're gonna like have to shuffle around a little bit. And that's kind of like what your blood does, if that makes sense. If your vessels are smooth, you don't have any resistance. But if your vessels are kind of rigid, kind of like carpet, then you have to kind of work a little harder. Resistance can also be other things too. But just for this sake, we're just going to just talk about the walls of the blood vessels. So viscosity means thick consistency. And this can also cause resistance to blood flow. So if your blood is thick and syrupy, it's not going to flow very well, right? But if it's nice and like fluid, then it'll flow very fast and very nicely. So that's that. And then cardiac output is the volume of blood pumped out of the ventricles per minute. So output of the heart is cardiac output, if that makes sense. Okay. Cardiac output can be calculated by taking the heart rate, so how many times your heart beats in a minute, multiplied by your stroke volume. And your stroke volume is the amount of blood that enters the arteries. So, right, how fast your heart is beating and how much blood is being pumped out every time your heart beats is your cardiac output, is how much blood is outputting from your heart. Your blood pressure then is your cardiac output times your total peripheral resistance. And that, I don't think I could fit total in this word, so I just put peripheral. But your total peripheral resistance is peripheral resistance. It's how much blood is, your blood pressure is how much blood your heart is able to pump out, multiplied by how much resistance that has. So you have cardiac output saying more pressure, and then you have resistance saying no blood pressure. So it's kind of a balance. If that kind of helps break down why that makes sense. You know, why those equations, hopefully.
How do you measure stroke volume?
Stroke volume, I don't know how you'd measure. Yeah, we'll probably age, yeah. Because, I mean, how much blood you have, how much blood you can hold. Is that an equation you guys have for stroke volume? If not,
Like in the book?
yeah.
I don't know.
Oh, okay. Well, if there's an equation for stroke volume, and it could be, I don't know, but I mean, that makes sense for age.
Gotcha.
So age could play a factor in that. Let's see. What controls blood pressure? I'm going to see how much of this I made you guys write. This one is pretty tedious, so. Oh, God, I'm sorry. I probably should have included some of this. So the control of blood pressure can be neural regulation. So you have your sympathetic and your parasympathetic pathways. This is your cardio-acceleratory, your cardio-inhibitory. But if you put I think I just wanted you to put the neuroregulation, the chemical, and the peripheral, and then you could probably figure out the rest of it from there if you really wanted to. The next control of blood pressure is chemical regulation. So chemical, this has to do with epinephrine, right? Epinephrine is a hormone, it's a chemical, and epinephrine says, speed up your heart rate. Yeah, you want to like run from those lions, right? You got to get away from that bear. So that's a chemical regulation. Another thing too has to do with the renin angiotensin system, urinary system. And we'll get into that shortly because you have chemicals in your body, hormones in your body that causes you to vasodilate or vasoconstrict. So that's nice. We like our chemicals regulating us, our nerves regulating us. And then Another control factor is, how much resistance do you have in your body? And this is controlled by your vasomotor center and your tonic contractions. So I do not recall off the top of my head what these are. You may want to look in your book, or if you stumble upon them in your book, it's there. But yeah, just peripheral resistance is probably good enough. Another control of blood pressure, and I know Janet likes this one, Starling's law of the heart. The more your myocardial fibers are stretched, the more blood you're going to push out. So the more in equals the more out. So the more stretchy your heart is, the more blood will come in, and the more will come out. So just kind of Starling's law of the heart. That's probably the big one. We're almost done with this one. Okay. And then, did I even pass them out? Maybe I didn't. Okay. All right. Next one. You get a diagram next. Ooh, lucky you guys. Anyway, so what does venous blood flow slightly depend on? Your venous blood flow really depends on your skeletal muscle contractions, because the more we contract, the more exercise we get, the more we're able to push blood out of our, we're able to squeeze our veins. We're able to squeeze all that venous blood out. So we like that. Breathing movement, when we breathe, that also can contract and relax vessels. So breathing is important, also for other reasons. But and then also venous vasoconstriction, because like I said, if you constrict, it's going to speed up blood pressure. So when your veins vasoconstrict, it's going to push blood out pretty dang fast. However, contraction of the heart, venous blanked only slightly depends on this. See how it's further? Just a little bit, not too much. Contraction of the heart is really what atrial blood flow depends on. So that one's kind of a trick question. Which one does it slightly depend on? It's just contraction of the heart. But the other three are pretty important, and I would memorize those. Hint, hint. So that is that. So while we're on the topic of blood pressure, we're going to revisit our Renin Angiotensin System. So the Renin Angiotensin System functions to increase blood pressure. So usually our Renin Angiotensin System kicks in when we're either dehydrated or when we sever our leg and we're gushing out blood. But typically people are dehydrated more often. So that's with that. So we want to increase blood pressure. We want to increase the volume of blood in our bodies. So your angiotensinogen is just like a hormone or an enzyme, and it's just floating around in your bloodstream. So that's the first step, is angiotensinogen. Actually, I could probably put that. So first step, angiotensinogen is floating around doing its own thing. Step number 2 is renin. You can't really see that, but renin is produced from your kidney, because your kidneys are the things that detect, wow, I'm not getting a whole lot of blood pressure, we need to increase. So renin will be secreted from your kidney. Renin will then touch angiotensinogen. Angiotensinogen will then turn into angiotensin 1. So that's the third step, is angiotensin 1. That's the third step. The next step is, well, angiotensin 1 doesn't really do a whole lot. The only thing angiotensin 1 does is it causes your blood vessels to vasoconstrict. And you vasoconstrict to increase blood pressure, which is nice, but we actually want to hold on to fluid. So what happens is ACE enzyme, which is just an enzyme in your blood, will then touch angiotensin 1, and it'll convert angiotensin 1 into angiotensin 2. Angiotensin II then causes three things to happen. It increases vasoconstriction. So vasoconstriction is nice because when we vasoconstrict, we increase blood pressure, right? Angiotensin II then causes I believe it's the adrenal glands to secrete aldosterone. And aldosterone is really important for retaining sodium, because when you retain sodium, you're going to retain salt, or you're going to retain water. So that's with aldosterone. Another thing too is you're going to excrete calcium or potassium. So whenever I think of aldosterone, I think of no more bananas. No more. Get those out of me. No more bananas. We don't want bananas. That's what aldosterone is saying. But it's holding on to everything else. And then the last one that angiotensin II does is angiotensin II goes up to the brain, tells the brain to secrete ADH, and ADH is anti-diuretic hormone, which causes you to retain water, which we like. ADH, by the way, is the hormone we went over in the endocrine system. Yeah, that when you drank alcohol, it caused ADH to not work. So that's why you pee a lot. So when you are like drunk, or actually a hangover is actually severe dehydration. That's why you feel really bad. And that's because alcohol inhibits ADH. It doesn't cause ADH to work, so you're going to pee everything out. But ADH is good because we like blood pressure. So, do you guys want to go over diseases and disorders? Okay. Okay, good. Because we could do it next time, but we also have blood, so. I passed out a diseases and disorders for respiratory. Do you guys have it? Yeah, last time I did.